Hello, everybody. Very, very happy to co-organize this event with WeRock and Innov. Innov is a French association which gather women and men in innovation. When I created Innov about 5 years ago now, the objective was to help women how they can succeed in innovation. And now with Veronique, we develop Innov and all the team to continue our way, but also to integrate also diversity, because we opened Innov to diversity last year, and we want to organize workshop on different innovation subjects. The objective is to develop our knowledge and do different workshops in a maker way, because what we want is each member come back to the company with something in the hand that they are able to implement in their company. Actually, Innov start to develop the association across the world. So we have a partner in US, and we have already made webinar with US. We already made webinar with Israel, because we have a contact in Israel. Now today is with Spain. So very happy to open our relationship to Spain. And next week it will be with Belgium. So we start to be a little bit international. It's just the beginning, thanks to the confinement. So very happy to organize this day on digital and health. And thank you, Gemma, for this presentation. And I would like to let you explain who is WeRock and what kind of organization you are, because it's very interesting to discover what you do. And thank you for being here.
Thanks to you. Thanks for the invitation. On the side of WeRock, there is also a lot of excitement that we can start cooperating and doing things together. If it needs to be remote, it needs to be remote. And we will very much look forward to the fall when travel is allowed again, hopefully, and we can meet in person. So now I suggest that I share my screen because my first two slides are actually the introduction to WeRock. And then without further ado, I could jump directly into the presentation on digital health, which is actually the topic for today, how digital health has been used and implemented and how it can be even more useful after this peak of the pandemic. So let's see if I do this correctly. Okay. Can you see my screen now?
We can.
Okay, wonderful. There we go. Let's make it bigger for you, a little bit more comfortable.
Just perfect,
Right.
Gemma.
Okay. All right. So who are we at WeRock? Okay. We are this diverse group of women. We come from different sectors, and we all have extensive professional experience, just like you, similar kind of team. Some are company managers, some are entrepreneurs, and some others are business women. We're really well defined just by three hallmarks. We're investing in women-led startups. So the woman may either be the founder, may be the co-founder, or may be a member of the board. We are defined by the fact that we share our experience while we learn. So sharing and learning goes hand in hand. We learn from entrepreneurs as we wish to learn from the ecosystem, the entrepreneurial ecosystem, to contribute agility and flexibility later on to our corporations. And then the third hallmark is that we accompany startups in a friendly way. So if we could only say three, those would be the three that I would highlight. We do not invest alone because we look for technology-based startups that are able to scale fast, and because our financial muscle is kind of relatively small. So because we're looking for quick scalability, we cannot invest alone. We usually go along with other investors. And in our storytelling, we tend to say, we like to say, we take pride in saying that we were born during a dinner meeting, and that's true. We were really born during a dinner meeting with friends, and there a WhatsApp group was created. And very quickly we came from that WhatsApp group to an organization which has different active committees that work in a very agile way. So that's our story, short. And our legal form, if you want to know, we are an association of professionals from various fields and sectors, as we said. And we communicate quite spontaneously, not very formal, in a modern and at the same time an inclusive and fresh way. I think that is the best communication style for us to connect with the startups. So in a nutshell, in 3 images, if you want to remember what WeRock is, we are scouters with criteria, plus friendly negotiators, plus loyal partners. And before I jump into speaking about digital health and so on, since we're so lucky to have our founder, one of our 2 founders here, Elena, with us, I don't know, Elena, the floor is yours if you want to add something and let the people hear your voice.
I had nothing prepared, so yeah, you did it well, perfectly. In fact, you explained everything. I would say the best we have of WeRock, it's the people, the women that belong to WeRock, because everyone there is so generous that, as Gemma mentioned, we were willing to share with the startups. We are willing to be really their friends, their partners on their travel journey. But it's not only for them, it's between us, the energy and what we learn between each other. It's also part of the identity that we have at WeRock. And that's just the beginning, because everything, it's, the floor is big. We can still do great things. And Gemma explained it very, very well. I had nothing prepared, but thank you, Gemma, for giving a little bit of talk for me. Thank you.
Okay, so now I think it's time to go into digital health. Maybe a little bit about me before. I've spent 23 years in my career doing clinical development, and only very recently I transitioned to digital health. It's very exciting for me. What I do now with a lot of passion and enjoyment is I lead what is called the Ferrer for Future. This is an open innovation program from a pharma company, a privately owned pharma company headquartered out of Barcelona. So the Ferrer for Future is the open innovation program from this pharma company that has a vision, of building a healthier society through digital technology, and at the same time, making an impact on the sustainability of universal healthcare. And the way we work is that we launch 3 challenges every year, and then we scout for companies, and we put them through a funnel and a selection process. And at the end, the winners, they get to collaborate with the pharma company. They get to collaborate with Ferrer. It's not very much a CVC model. It's more a client venturing model, but that's just a detail. So in any case, I'm not going to go through the specific therapeutic areas where we're interested in. That's not relevant. I think I will very quickly jump onto what is digital health. And now, before I start, let me introduce you to Emily. Emily is a grandmother in Boston, Massachusetts. So she suffers from mild depression, and Emily uses a cognitive behavioral therapy on her smartphone. This means that Emily does not have to go to the psychiatrist once a week. Instead of that, she does have access to a digital therapy on her smartphone, and she can use it as often as she needs. So this means that she can self-administer herself a session with a digital therapy, say twice a day, 3 times a day, 3 times a week, at a time of her convenience, whenever. So the data that Emily generates when interacting with her phone, with the digital therapy session on her phone, all the data that she generates is collected in the same platform where Emily's electronic health records are stored at Mass General Hospital. And Emily also wears some sensors. She's got wearables on her shirt, and she's also got a smart mattress that monitors the quality of her sleep. So now, all the digitized data flows that are generated either by Emily when she talks to her smartphone, or by her mattress, or by her sensors in her shirt, or whatever, they go into a data lake. And in this data lake, the data from many other patients, just like Emily, all the data goes there also. And this enlarges the population base to run advanced analytics. So from the advanced analytics, ongoing improvements are made in the care of mild depression, which is Emily's disease or Emily's condition. So now, Emily's personal avatar on her smartphone analyzes her data in real time. It compares it with the data that is relevant from the big data lake. So there's been analysis to the population level, as well as analysis at the individual level. And by comparison, the avatar can suggest Emily improvements in her personal therapy. And even Emily can be sent new prescriptions or can be sent refills of the drugs that she's already using. Now, this is all possible because the platform where Emily's data goes is also integrated with electronic prescribing and also with home drug delivery services. Now, so far for Emily's story. And well, you can tell that I very recently took a course on storytelling from a colleague at WeRock, and I had to put it in practice. So here goes the story. Instead of talking directly to you about all the technologies that power digital health, we look at Emily's story, and now you can see that there is a large number of technologies involved in the creation of the platforms and the new ways of delivering patient care. So of course, there's artificial intelligence, connected devices, IoT, patient monitoring that are like remote, and then blockchain to securely track the medical records from Emily, to securely track the prescriptions and the confidentiality of it all. So basically, the new ways of delivering care involving telemedicine or virtual reality or robotics or whatever, so basically digital health cannot be described as like one technology. So that's why it's so difficult to make a classification, because usually for each digital health service, there is a large number of technologies overlapping and converging. And on top of it all, because we want real time, there is also 5G. So much for the amount of technologies running behind the service. Now, what is digital health? If digital health is not technology, what is it? Digital health is the cultural change that empowers the patient as a healthcare partner. Of course, it is powered by technology, but digital health itself is the cultural change. So digital health lies in the convergence between digital technologies and then how we understand health itself, how we understand healthcare, and how healthcare is delivered to us, and then how we live in society, right? Through digital health, we are able to attain better clinical outcomes, which is beneficial for us as patients. We are able to reduce the friction in the action of delivering the care, which is beneficial for the healthcare professional, the doctor, the nurse, the caregiver. And then it also increases efficiency and reduces costs, which is beneficial for us all because it benefits the health system, but also at large, it contributes to society because we make healthcare systems more sustainable and more universal, right? So now, digital health is indeed a cultural change. What is not digital health? Digital health is not a jumble of new technologies that are plugged into the existing processes and patient journeys of our good old healthcare system. That's not digital health. That's a different thing. Now, everything starts, as you can see in this slide, by putting the patient at the center. You can see, oh no, yeah. So we put the patient at the center, right? And then the beauty of the connected technology is that it allows the convergence of everything that is related to healthcare, but also everything that is related with education and the socio-economic aspects of care. So we as a patient in the center will receive health services in an integrated manner with the rest of the services that we need to receive as a citizen, not only as a patient, but also as a citizen. And this is why digital health is a major paradigm shift in how we understand health and healthcare in an integrated way with the rest of our lives as citizens, right? So now, having said what digital health is, actually, you can interrupt me anytime. If anybody has a question, I mean, we do not need to wait until the end, right?
I would have if that's okay with you.
Please go ahead.
I'm doing a lot of change management in terms of digital transformation, and one of the biggest concerns that I think people have in terms of health, it's a very private matter for the patient or the individual, and if the data is very shared, you may be very afraid, exposed that some institutions or bodies may not use it for the right reason. So, I mean, I'm thinking of insurance companies, maybe employers. So how do you manage that in a digital health ecosystem? How do you protect the data privacy and the protection of the individual freedom?
Yeah, thank you. This is essential. This is a very, very good question, and privacy is very relevant. Health data scores at the top level of data privacy, so it deserves to be taken care as such. What is usually done, not yet implemented all through, but the plan is that each individual will have one single digital identification number, one single digital identification code, and then all our sensitive data will run probably on blockchain or something similar to blockchain, in a way that besides being forging, being preventable, besides that, you as an owner of your own data, as a patient owning your data, you will be able to choose what portion of your data you wish to share with whom. Of course, it will not be the same data that you share with your employer, than the data that you share with your doctor, than the data that you share with your insurer. So at one point, and once this is fully implemented, and the European Union is already working in the platforms and the infrastructure and the architecture of the infrastructure that this needs to have, hopefully each citizen and patient will have the right to decide what portion of own data is to be shared with whom. I hope I have answered your question.
Yes.
I think what you said, Gemma, is very interesting, because with Veronique, we went to Estonia. And in Estonia,
example.
we have seen the X-Road platform, and just magic. It's just fantastic how they manage and put the citizen in the center
Absolutely.
all the process, I mean, all the government, all what's happening in this country. And they do exactly what you say. They can open the data or not to a doctor or whatever, to the insurance or not. And they have a total control of the data. And at the same way, it's totally digital. And it's just very fantastic to see, and very efficient, and simplify their life.
Yeah, absolutely. Okay, then I move forward. So let's look at some digital health examples that have been used during the pandemic. Now, with regards to the adoption of digital health, it needs to be said that this pandemic has been a massive accelerator of adoption. First, because hospitals were overburdened, and then, of course, only severely ill patients, they could be seen face to face. And then the second accelerator was to reduce the risk of cross-contamination. So during these past 3 months, we have seen a shift towards point of care, and also the patient journeys, they have changed forever. Remote monitoring and telemedicine, they have been commonplace. And in this way, doctor-patient visits have been eliminated whenever possible, whenever this was avoidable. They have been eliminated, right? So let's look at some of the technologies that have been used. The first one I wish to focus on is artificial intelligence. AI has been very present. Number one, to power the new outbreaks, like this Canadian startup, Blue Dot, who was the first one, an artificial intelligence system, was the first one to detect the Wuhan outbreak, right? Another example where artificial intelligence has been used is to forecast the pandemic evolution on real time by mapping the cases. So there's been a number of such tools. The one I've been using most is that produced by the Engineering Center at John Hopkins University, but there's others. Gigasun Data is the one I've been using, the one on the left, but there's others. The one in the right belongs with Microsoft. Also, artificial intelligence has been very useful for image analysis of medical images for diagnostics. So Alibaba, the Chinese Alibaba, produced an AI algorithm that from a medical image, they could detect coronavirus in seconds with 96% accuracy. So you would feed the image, the lung image, into the AI algorithm, and this would be able to confirm with a very high precision, very close to 100% precision, whether that patient had a fibrosis of a coronavirus origin or not. Also, to make a forecast of the evolution of that patient, the AI system could predict whether the patient was going to need in the first few days, in the upcoming few days, the system was able to predict whether the patient would need to go into the emergency room, whether the patient would need to be intubated. So an evolution of the worsening of the disease could also be predicted. Also, AI has been used to digest scientific publications. There's been so very many publications that any one scientist could not read it all, could not possibly read it all. So a pre-digest from an AI intelligence system could allow that each scientist was downstream directed only to the set of publications that were interest for him or her and where the scientists could contribute the most. Also, chatbots and symptom checkers, there's been a ton of those. AMWell has been the one used in the US, Stop COVID has been the one used in Spain. Ali Health has been used in China. Pagine Medici has been used in Italy. There's been a lot of those. I'm sure that we have all used one at some point when we wanted to discriminate whether the fever that we had and the coughing that we had was a common cold or was maybe symptoms of coronavirus. And then also AI has been very much used for contact tracking. Different countries have used different methods with different degree of surveillance, but in the end, in the background, all of them were based in AI. Another technology that has been very much used is 3D printing in cloud. This has been used for open sourced printing of masks, the shields, and also pieces for the mechanical ventilators and valves to connect the respirators to the snorkeling masks that have been reconverted into oxygen masks, right? And then also robotics has been very relevant. It's been relevant for disinfection of wards. If you look at the slide, the top left picture depicts a robot that was used to deliver medicines at home, to deliver medication at home. This was used not only for clinical trials, of course, but also for patients who could not access the hospital. And such robots are a very good example of what we were discussing earlier about convergence and superposition of technologies in each digital health solution. Such robots, of course, they are robots, so that's technology number one. But they have got sensors, technology number two, so that they can sense the weather, for instance, and they can autonomously change their route in case of a storm approaching, for instance. But also they are connected to the data lake where the patient data is going in real time. So the robot who has got a delivery list in a certain order can autonomously shift the order of delivery in case that one patient worsens faster than another patient and becomes higher up in the priority list. So this is just an example on how several technologies do merge in one digital health solution. What else do we have here? Oh, social media. Social media technically is not digital health, but when the World Health Organization itself starts using it for official communication and patient education, then it becomes part of the game, right? Okay, so now the future. While we wait for an approved treatment and a vaccine for herd protection, all the public health protocols to detect, to test, to track contacts, all of them, they largely rely on the superposition and convergence of technologies, right? So when we go back to the office, and those of you who have already gone back to the office, I'm not yet, we're still holding it back. But once you go back to the office, I mean, I love this picture because it basically shows it all. How the bus, that the public transportation, bus or train that takes us to the office has got now new rules. So we are all sitting apart, like social distancing in the public transportation. Then the shifts have been changed. We all work in different shifts so that the amount of co-workers that we meet at work is less, is cut by half or 2/3, it depends, right? And we all have those sensors in the offices or sometimes at the entrance to have our temperature taken, and then we have to wear masks and we use hand sanitizer. There's a lot of changes. Some of us work from home either all the time or at least a few days a week. So there's a lot going on. And then there is this contact tracker that hopefully is different from the contact trackers used in the peak of the pandemic, where the government surveillance element was very, very present, not only in China or Korea, also in countries in Europe, like in Italy, for instance. At least the government in Italy has committed to destroy all the contact data at the end of the year. So December 31st, they will destroy the contact tracking data that they have gathered. But there's systems now which use Bluetooth instead of GPS positioning. So if we are in contact with work colleagues, for instance, and then 3 days from now we develop a fever and we are diagnosed with COVID, then the colleagues who have been in touch with us for longer than 15 minutes and closer than 2 meters, they get a notification. And here there is no involvement from the government or no involvement from the company managers or whomever. And this is somewhat more respectful with privacy, right? Okay, what else? Devices for germ protection. I'm not sure how successful those will be, but there's a lot of devices already on the market to try to avoid us from scratching our face, touching our eyes, or So there is all sorts of solutions that send us warning to keep us away from germs. The next one that I wish to share is point of care and telemedicine. Be synchronous or asynchronous telemedicine, meaning that this is maybe a session where the patient and the doctor are connected at the same time on a video conference, or asynchronous, where me as a patient, I would see a rash on my skin, I would take a picture and I would send it asynchronously to a data center, and I would receive support or medical support later on after my image has been analyzed, right? Okay, what else do we have here? Oh yeah, that's a very important one moving forward. I mean, there will be, as we said, one single digital identity number for our electronic health records, and we will be able to use them across borders. So there will be interoperability of healthcare records, and our vaccine passport, for instance, linked to blockchain or to another safe technology to avoid forging and so on. This will track all the shots that we have received during our life, including the shot of coronavirus. And this will be what will allow us to travel across borders. Then also maybe mental health is a very important one. Since the lockdown has played hard on many people, so mental health is also one of the areas where digital health solution will be most used moving forward, especially because there is a very important lack of healthcare professionals. There is not enough healthcare professionals, psychiatrists, psychologists, people specialized in central nervous system to take care of the whole population who has mental issues right now. And this is getting worse. It was already true before the pandemic, but it's getting worse now. And then also digital health solutions for the quality of sleep, right? So I think that in probably, I don't know, it's been half hour or so. I think that in half hour, we've seen a lot of the digital health solutions that have been used already, and some of the digital health solutions that I humbly think, I may be wrong, that will continue to be used at a high intensity now in the few months to come. And yeah, well, one last reflection maybe is that while researchers are looking for the treatment and the vaccine, we should, as a society, we should make sure that not too many data is left in the hands of too few people. And as you can see, I mean, Apple and Google are making partnerships to have a more powerful platform to collect health data. And this is in line of the question that you guys asked earlier, that we have to make sure that the ownership of the data remains with the patients and the citizens. Okay, and before closure, one last reflection maybe, which is my reason to be happy at work. Why do I enjoy working in digital health so much? And this is because of the purpose. I already shared earlier that I see digital health as the tool, as a key and powerful tool to help in the sustainability of healthcare systems. I'm going to explain why, but also by contributing to the sustainability of healthcare systems, indirectly is contributing to the reduction of inequality, social inequality. And that makes me happy. That makes me go to work every day. From the environmental sustainability point of view, digital health reduces emissions and chemical waste, because we are able, as I explained in the case of Emily, right? There is individual data collected in real time that ends up landing in a data lake where populational data is constantly arriving, like digitized data flows come to that data lake, and they allow us to make more precise diagnoses and to deliver more personalized treatments. So there is less chemical waste, there is less emissions. Also less paper, because everything goes on digital, on platform, so we contribute to destroy less the Amazonian rainforest, for instance, because we need to produce less paper. And also because there is fewer trips to the hospital, the patients can receive care from home, from wherever they are. There is a positive impact in the carbon footprint, all right? So we also have a better traceability of the whole system. And from the perspective of social sustainability, by reducing the costs of care, we are making healthcare more accessible, and therefore we reduce social inequity, or we increase social equity, put it the way you want. Also, through digital means, we are able to improve the patient's or the citizen's education, and we are able to empower the patient/citizen, and therefore, by empowering them, reduce marginality. What else? With regards to social sustainability, also by improving traceability, we facilitate accountability and responsibility for better governance of healthcare, which is also very desirable. And then we improve universal accessibility, because we deliver care at the point of care. So patients in a remote location in Africa or wherever, as long as they have a cell phone, they have access to care, and therefore they have greater access to quality of life. And then last but not least, with regards to economic sustainability of companies, digital health is a good investment, because it's a new source of income for the traditional pharma companies, like the pharma company I work for. but also because it allows an increased income from existing medications. And this is when we produce a digital solution for disease management that allows pharma companies a better life cycle management of existing drugs. This means that they can keep, or we can keep, older drugs in the market for longer time, because we couple them, we combine them with digital therapeutics that improves the use of such drug. You can imagine, it's very well known, the example of insulin. Like a diabetic patient takes insulin, it does have an effect, but the clinical outcomes are much better when the patient is provided a tool, a digital tool, to manage the whole disease, to manage the level of glucose in real time, and know exactly which is the dose of the next insulin administration, what are the amount of sugars that can be intaken in the next meal, and so on and so on. So from all angles of sustainability, economic sustainability for companies, social sustainability, and environmental sustainability, digital health is a great deal. And that's that. Thank you very much for listening. Yeah, thanks.
Thank you very much.
I'm driving, sorry.
That was great. That was great. Thank you for sharing. I don't know if you have some question.
I'm trying to stop sharing my slides, but I do not seem to be very...
The bottom where you were able
yeah,
to...
I lost my button.
If you scroll, normally the menu...
Oh, right here. Yeah, there we go.
There you are.
Perfect.
Okay.
So, if someone has a question to start, maybe
I have a question, Gemma. Cool. This is Estrella. Can you hear me well or not?
Yes, Estrella,
yes.
Go ahead, please.
Yeah, I'm always curious about what is your point of view regarding the roadmap of how digital health should be implemented. So where is, I mean, we have now this current situation. We have been using many different apps for everything and artificial intelligence, but what next? Should we start by the hospitals, by the pharma, by the privates, by the government? How do you see the roadmap to up to which extent are we going to be able to develop the digital health?
Yeah, I mean, hospitals are a very good start, and hospitals are now very open to this because they've been put through what they have been put through. So in the past, there were basically two levers for adoption of digital health, right? One was that we were hoping for the population coming to realize that a very high percentage of our health is not contributed by drugs or by doctor interventions. Between 30 and 50% of our health is contributed by, you know it, diet, exercise, I mean, a lifestyle without alcohol, without smoke, compassion, mindfulness, positive thinking. A lot of our health is contributed by that. So the people who would realize that soon enough, they were more inclined to use digital health solutions. The second lever that we had in the past for the adoption of digital health was what I mentioned earlier about the shortage of healthcare workers in the world. I mean, we people live longer and we all have chronic diseases. And there is very soon going to be 1.6 billion of people in the world over the age of 60. And the number of physicians and nurses is so small that you would not believe it. So anyone with a smartphone, I mean, is able to enhance health outcomes. And if we all do it at the same time, this enhancement of health will happen at scale, right? But now, after the pandemic, the implementation of digital health is driven by more levers. Lever number 3 is that hospitals have been overburdened, and they could only see patients that were severely ill, and now they no longer see them face to face. I'm sure that you have already experimented yourself that there is an inclination, there is an openness of the hospitals to deliver visits through video conference, telemedicine. And then the risk of cross-contamination, we have to continue to reduce this.
No, this is yeah.
In the future peaks of the pandemic. So I'm sure that hospitals are a very smart place to start.
Okay, thank you, Gemma. Yeah, I fully agree with you.
Yeah.
I think that it's not only the pharma, it's the hospitals, it's the government, the compromise from the government.
No, it's together.
Governments.
It's together.
Yes.
Pharmas will start selling to hospitals because in the access chain, the market access for hospitals, they will be very open to co-develop with us, with the pharmas. They will be very open to co-develop the solutions. And then we together will have to figure out which is the payment or the reimbursement method in a value-based healthcare environment. This will need to be co-developed. But now it's the time to get in, to get one foot in, because the door is open, the gate is up.
I think
I have a question.
Yeah. Benedict.
Good.
Hello, Helen.
Oh, hello.
Hello, this is Montse from WeRock. Hello.
Okay.
Can you hear me?
Après Benedict. Yes, we can hear you, Montse.
Merci. Gemma, I have a question.
Montse, what are you wearing?
You look
a
so
mask.
American, Montse.
A mask.
That's
A
cool.
mask from France, in fact. It's a present
Very
from my
cool.
son who lives in France. So,
Yeah.
so my
That's
question
because
is,
you are a
Gemma,
superstar. You wear a mask with stars, right?
WeRock. We
WeRock.
are WeRock. So thank you so much, Gemma, for sharing again this inspiring presentation. And my question is, I saw in Germany that was the digital therapeutics has been approved very recently, and also even the reimbursement of digital therapeutics for patients. Just this week we had, late last week we had FDA also approving a digital therapeutics for kids. Do you think now, thanks to the COVID and all this pandemic, we are going to see more and more products like this into the market, getting faster when it comes to the approval and also the acceptance of doctors? What's your opinion, Gemma, about it?
Good question. Yeah, I mean, Germany announced this new regulation back in November, and it was a very exciting last quarter of the year for all the ecosystem of startups and larger companies working in digital therapeutics to finish their developments, because the German government kind of allows you 1 year, is a 1 year huge pilot study during which you are able to prove that you are delivering the good health outcomes that you have promised in your application. Now imagine that you don't deliver, then your digital therapeutics is removed from the market, and I do not think that the government is ever going to give you another opportunity. But at least for 1 year, you're able to commercialize your solution and you're able to collect data to prove this. I think this is a very courageous solution from the German authorities, and I wish that this would be contagious and many other countries in Europe would adopt this. Of course, there will be a handful of startups that will take advantage unlawfully of this situation, and they will use this first 1 year to cash their solutions and then disappear from the market. But I trust that this will be the minimum amount, and most of the companies, they will stay, and the solutions will be able to prove the outcomes, the clinical outcomes that they claim. So yes, I think that Germany has set the good example, a wonderful example, and hopefully the fast track will be imitated by other countries, other member states in the European Union.
Thank you, Gemma. I agree.
It's not been
I
the
totally
case.
agree.
Yeah, thank you. It's not been the case so far. It's not been yet adopted. A fast track for digital therapeutics has not yet been adopted by EMA, by the European Medicines Agency, which would have been my dream, by the way, but it hasn't happened so far.
Totally agree. Yeah, yeah.
I think Benedict have a question.
Yeah, I have a comment and more comments, in fact. So thank you very much, Gemma, for your presentation. It's working in the field of digital health. I totally agree with your vision. For me, digital health has already shown positive outcome, but the problem was adoption and remains adoption. What we've seen during COVID is that some of these digital therapeutic, digital health, or digital solutions have been largely adopted, like telemedicine, some remote patient management for in some cases. But what remains for me a big challenge is the adoption by the end user. Because coming from the pharma industry like you, we've been looking at it from a very pharma and healthcare perspective, and probably not enough in terms of how does it fit in people's lives, how does it serve the end user needs. Because at the end of the day, you can do great things, but if people are not using it, you don't collect the data, you don't get the value out of it. So I believe that COVID has been an accelerator for healthcare professionals to use that. How do you see the future of you and me using more of this solution?
Yeah, good question. Adoption is a key issue, and you're right. I mean, the past few months have been like a test turf to see, to have a little peeping into the future, you know. I think that because digital health tools allow access to health education, and therefore they allow access to change behaviors. As soon as we get a minimal critical mass, we will get the ball rolling.
Yes.
I think it will have this kind of effect. Also, because digital therapeutics, these are not very well known yet, because people are used to get drugs, to get chemicals, when they need to get better. But the fact that some interventions on your health can be delivered through software, eliminating the drug. For instance, for mild depression, you eliminate the antidepressive and you go to cognitive behavioral therapy on your cell phone, right? So as soon as digital therapies are more introduced, they will also have a big impact on the mindset and on the adoption. That's, in short, what I think.
There is a lot of work to be done at the for the digital therapeutics itself. There is a lot of work to be done at the healthcare professional level, because they need to recommend it. They need to not only to prescribe it, but to convince people to use it. And for that, they will need to be convinced themselves.
Absolutely. So, and in order to convince them, we need to improve what is called interoperability. Doctors do not wish to go into one platform to see the data on my depression, the evolution of my depression, because I'm using cognitive behavioral therapy. Doctors want to go into the healthcare records at their hospital, on their platform, and they want my data to be integrated there. So anyone working on digital therapeutics, we need to take care of removing friction for the healthcare professional. And this means that we are responsible for the integration layer with the healthcare records, with the healthcare system, whatever system is used in each territory. So connectivity and integration is on us. And once these issues are solved, I think that the resistance to prescribe digital therapeutics and monitor them and continue to impulse their use, I think that this resistance will be removed.
And this is where email must play a role, because they will be the one forcing the standards more than going country by country. Agree.
Agreed. Thank you.
Can I have a last question? Is that okay, Hélène?
Please.
Yes. It's so, I mean, I have tons. I had to pick up one because otherwise, you know, would have taken too long. You mentioned, and that's really a topic of interest for me, coming from that world, that the Microsoft, the Google of this world, and the Alibaba are really taking a key role in medical field altogether through the data. They have a different culture from the medical world. They are less risk averse. They're very commercially driven with their data. How do you see this collaboration of these two worlds moving forward in the future? How do you see that working well?
Well, I'm very excited about this collaboration, as long as it is collaboration. The thing here is that the tech giants who started collecting what we call real world data, right? Not very deep into health data, but more wellness data, right? So that's what they started collecting. And that real world data from all sorts of sensors is a wonderful complement to the healthcare records. The thing now, because I mean, it's richer when we can be someone, a doctor or someone can look at us knowing our healthcare data strictly, but it's much better when they can look at us knowing our healthcare data and our wellness data, how much we sport, what we eat, I don't know, all sorts of things, how we sleep, all these. So it's richer, and being richer, a better we can receive better advice then. The thing here is that now all the sensors and devices developed by the tech giants, they now include core health data that we citizens, because we are happily sharing wellness data with them for many years, we start to contribute to their data lakes our core health data without thinking it twice. I'm not sure if I would like Apple and Google to have all my data, even if they claim that they anonymize it. I'm not sure that this is my preference. In a cooperation between tech, healthcare system, tech companies, healthcare systems, and pharma companies, and whatever, I would be more comfortable because, as Yuval Noah Harari says, our risk towards the future, moving forward, our risk is to let too few people hold too many data. So we need either to have it on blockchain where control is granted, or if we're going to give it as a gift to society because it's for the good of all, the richer the data lakes, the better advanced analytics will be able to be run and the better medical advice we will receive, right? That's for a fact. But If it's not going to be on blockchain, if it needs to be given as a gift to society, I would rather deliver it as a patient or as a citizen to a consortium that is not purely owned by tech giants or pharma companies alone. That's my preference.
Thank you. A governance question. Okay.
Yeah.
Great. Thank you.
Thank you for the very interesting questions, guys.
I'm sorry, but it's time to go.
Looks like so.
I thank you very much, Gemma. It was very great.
Yeah, my
presentation.
pleasure.
Very
My pleasure.
interesting.
Awesome.
I think that everybody is very happy about this presentation because I can see some comments on the right on my screen, and they said thank you very much.
Okay.
I would like to thank you also, Manse, because you decided on WeRock and you didn't know, we didn't know very well each other, and it was a great opportunity to propose to do something with Innov. And thank you very much to WeRock to propose this webinar tonight. So it was really great. I think if you have maybe any question, come back to us, because we're going to put the replay on the Innov website. We will going to send the replay to WeRock. And if you have any questions,